Respected audience, this is Naushab A. Khan, attorney at law, adjunct professor law. In this series of programs, we are discussing medical negligence. In our previous part, we have discussed the civil negligence and some of the aspects of criminal negligence. And today we will further discuss criminal negligence. And in our earlier program, we have discussed that breach of duty of care by commission. So if doctor commits an act which falls within the mischief of medical negligence, then we will say that this breach of duty of care is by commission. A doctor has committed something which has resulted into the negligence. On the other hand, if a doctor fails to or omits something, we call it breach of duty of care by omission. So this omission, it is an act that means not doing something which every reasonable doctor will do. So we need to bear in mind the difference that there are two facets of medical negligence, and especially gross medical negligence. One is by commission and second is by omission. So if doctor commits something which falls within the purview of negligence, that is by omission, and if doctor omits something and resultantly there is a medical negligence, we will say that this is the breach of duty by omission. Now let's talk about certain examples of breach of duty of care by omission. For instance, giving certain injection without test for sensitivity, whether the patient is allergic to the said injection and the patient develops allergic reaction, or give intramuscular injection to uh, uh, intra vein, and resultantly the patient died, or there are serious or severe ailment of the patient. Now these in fact omissions, we can say that brings the act of doctor within the purview of breach of duty of care by omission. Now let's further discuss certain aspects that normally criminal negligence, which is a gross negligence, that in most of the cases results into criminal prosecution against the doctor. We will discuss in our next program that how one can avoid these kind of harsh circumstances and what defenses are available to a healthcare service provider or healthcare establishment to safeguard his license to practice, as well as to avoid any imprisonment or incarceration or sealing of his hospital or cancellation of license issued by Healthcare Commission. In next program, we will discuss these details. Have a blessed day. Thank you.